Many children and adults with genetic syndromes and severe intellectual disability display behaviours at challenge. Behaviours at challenge is an umbrella term used to describe a number of specific behaviours, including behaviour directed towards oneself or self-injurious behaviour, behaviour directed towards others, and behaviour directed towards property. But this term can also include other behaviours like screaming or stereotype behaviour. People with some genetic syndromes are more likely to display behaviours at challenge over other genetic syndromes.
Research and clinical experience shows that behaviours that challenge have many different causes. Often, behaviour is attributed to the fact that someone has a genetic syndrome or a severe learning disability, and this often leads to important causes of behaviour going unidentified. This is known as diagnostic overshadowing, and it can be reduced when we consider intellectual disability as a description of intellectual and adaptive skills, rather than an explanation for all accompanying features of intellectual disability. Identifying the underlying cause of behaviour or factors that influence the behaviour is important to best support individuals with learning disability and their family.
Cerebra have published the Be Well checklist, which is a list of things that are important to consider when thinking about behaviour in children and adults with severe intellectual disability. The items in the checklist are those that have a direct or indirect influence on behaviour, are often missed or neglected, and are those that can be changed or accommodated, resulting in a reduction of behaviours at challenge. The items on the checklist include pain and discomfort, sensory impairment or sensitivity, anxiety, sleep difficulties, emotion regulation, impulsivity and insistence on sameness, social behaviour, learned function and communication.
An example of where identifying the cause would be helpful is in an individual with severe learning disability who has an unidentified painful health condition, such as gastroesophageal reflux. Painful health conditions such as reflux often go unidentified in people with severe intellectual disability, given differences in verbal communication of internal experiences. Behaviours that challenge are often a form of communication, and so the pain that untreated reflux causes results in behaviour. This may be particularly the case around meal times. Once a painful health condition like reflux is well managed, we often see a reduction in behaviours that challenge.
Understanding phenotypes associated with genetic syndromes can help us to pinpoint causes of behaviours at challenge. For example, anxiety is heightened in individuals with Fragile X syndrome, reflux is heightened in those with Cornelia de Lange syndrome, sleep difficulties are heightened in Smith-Magenis syndrome, and so these are important considerations when supporting individuals with these syndromes. Most other influences on behaviour that are included in the Be Well checklist have an accompanying Cerebra guide that provides information on how to identify and support individuals with learning disability who experience those causes of behaviour.